Hey everyone. In counseling and psychological assessment, scores are only meaningful when we understand the context behind them. In this lecture, you'll learn how to interpret assessment data more accurately and ethically by exploring concepts such as norm referenced and criterion referenced tests, percentile ranks, standard scores, and standard deviation. And we'll look at how assessment scores are used in counseling settings to support diagnosis, treatment planning, and clinical decision making while recognizing the limitations that can arise when numbers are interpreted without context. So imagine two clients both receive a score of 85 on an assessment. Did they perform the same? At first glance, most people would say yes, same score, same outcome. But in assessment, numbers without context can be incredibly misleading. An 85 on an IQ test means something very different than an 85 on a depression inventory. An 85th percentile ranking means something completely different than answering 85% of questions correctly. Even the age of the client, cultural background, testing conditions, and purpose of the assessment can completely change how we interpret that number. So today's lecture is really about learning how to think about assessment scores rather than memorizing math formulas, because nobody wants that. Because counselors are not statisticians sitting in a lab somewhere, we are interpreting human experiences through data. And that means context matters constantly. You can sometimes compare this to temperature. So, a temperature of 98 degrees is normal for a human body. A temperature of 98 degrees outside means people are canceling outdoor plans and hiding in air conditioning. Same number, totally different meaning. Assessment scores work the same way. One of the biggest misconceptions counseling students have is thinking assessment interpretation only matters for psychologists doing formal testing batteries. But counselors use assessment constantly. You'll see it in suicide risk screenings, depression and anxiety measures, ADHD screening tools, substance use assessments, trauma inventories, career assessments, educational placement decisions, treatment planning, and progress monitoring, and so much more. Sometimes you'll administer assessments yourselves, other times you'll read reports written by somebody else. Either way, counselors have an ethical responsibility to understand what those numbers actually mean and what their limitations are. And the ACA Code of Ethics specifically states that counselors should consider validity, reliability, psychometric limitations, and appropriateness when selecting and interpreting assessments. And honestly, this becomes especially important because numbers can create a false sense of certainty. If I say, this client has severe depression symptoms according to the PHQ-9, that sounds very official and objective, and it wasn't just my tone of voice. But assessment interpretation is never completely objective. There's still clinical judgment involved. Now, a raw score is simply the number of items somebody gets correct or endorsed. So, for example, it would be like 17 correct answers, or 42 points, or a total symptom count of 12. But raw scores by themselves don't usually tell us very much. Let's say both people get 17 questions correct. Was the test easy? Was it difficult? Were they children or adults? Was the norm group representative? What was the purpose of the assessment? Without context, the number is incomplete. Let's think about video games for a second. If somebody says, I scored 12 kills, okay, in what game? 12 eliminations in Fortnite means something completely different than 12 points in basketball or 12 wins in Mario Kart. Assessment scores need interpretation frameworks. The score itself is not the whole story. One of the first major distinctions in assessment is understanding the difference between criterion referenced and norm referenced tests. For criterion referenced tests, these compare a person's performance against a fixed standard. The question is, did this person meet the benchmark? Some examples might be a driver's license exam, or CPR certification, or licensing exams, or some substance use screen cutoffs, or even PHQ-9 severity categories. You either met the standard or you didn't. Nobody cares whether you did better than everyone else on your CPR exam. They care whether you can competently perform CPR. That's criterion reference thinking. Now, norm reference tests compare a person to other people. So the question becomes, how did this person perform relative to others? Examples here might be IQ tests, SAT or GRE scores, personality measurements like the MMPI-2, or many ADHD and behavioral assessments. So now we're talking about ranking and comparison, and this is where percentiles and standard scores become important. Sometimes explain this using reality TV competition shows. So criterion referenced would be, can this contestant sing on key? Norm referenced would be, was this contestant better than the other contestants? Those are very different questions. So let's make it clinical. Imagine two clients both score an 18 on the PHQ-9 depression screening. Technically, both would fall in the moderately severe depression range, but their actual presentation may look completely different. Client 1 might be missing work, feeling socially isolated, having active suicidal thoughts, poor sleep, and no support system. Client 2 might be functioning relatively well, strong family support, symptoms connected to a recent breakup, engaged in therapy, and motivated for treatment. Same score, different clinical picture. And this is why counselors do not reduce people to numbers. Assessment helps organize information, it does not replace clinical judgment. This is honestly one of the dangers of over-reliance on assessment tools. Sometimes clinicians begin treating the score rather than the person. So percentages versus percentiles. It's one of the most commonly confused concepts in assessment. Percentage refers to how many items somebody got correct. So an example might be, Sherry scored 70% on the test. That means she answered 70% of the questions correctly. Percentile ranks compare someone to other people. If Sherry scored in the 80th percentile, it means that she scored equal to or better than 80% of the people who took the test. That does not mean that she got 80% correct. Remember, she only got 70% correct. You might mix this up, and it's okay. Here's another example. So imagine you are watching the NFL draft combine. If a player runs faster than 90% of athletes, they are in the 90th percentile for speed. That does not mean that they completed 90% of the race. It means that they ranked higher than most people. Percentiles are about relative standing. Now we move on to statistics language a little bit more. The mean is simply the average. The standard deviation tells us how spread out scores are around that average. A small standard deviation means that most scores cluster together closely. A large standard deviation means that scores are more spread out. You might want to compare this to traffic. So imagine rush hour on a highway. If every car is moving around the same speed, traffic looks compact and clustered. That's a small standard deviation. But if some cars are crawling at 20 miles per hour while others are flying past at 90 miles per hour, like on Route 28 if you're from Pittsburgh, that traffic becomes more spread out. And that's a large standard deviation. In assessment, standard deviation helps us understand how unusual or how typical a score is. So many assessments are based on the normal distribution curve, aka the bell curve. It is this classic bell-shaped curve that most people picture in statistics. You've probably seen it 100 times before. Most people cluster near the middle. Fewer people fall at the extremes. Height is a really good example. Most adults are somewhere around average height. Very few people are extremely short or extremely tall. And many psychological characteristics distribute similarly, like intelligence or some personality traits or academic achievement or some behavioral measures. Although importantly, not all human experiences follow a perfect normal curve. For example, trauma symptoms or severe depression in community samples may not distribute normally at all. And this matters because many standard scores assume a normal distribution. So here, I don't want you to panic when we're going to start talking about standard scores because it does sound complicated, but they are actually pretty simple conceptually. A standard score is just a translation system. Raw scores get converted into common language with a fixed mean and standard deviation. This lets us compare scores more meaningfully. So different types of scores might include Z-scores, P-scores, IQ scores, STAY-9s, and STEN scores. So think about it like converting currencies. If somebody tells you that they paid 5,000 yen for dinner, you might not know whether that's expensive until it gets converted into a currency that you understand. So, for instance, 5,000 yen is about 32 United States dollars. So expensive, not expensive, seems pretty affordable. So standard scores are going to help convert raw data into interpretable meanings. Now, a Z-score tells us how many standard deviations a score falls above or below the mean. A Z-score of 0 means exactly the average. Positive numbers are above average, negative numbers are below average. So +1 means 1 standard deviation above the mean. -2 means 2 standard deviations below the mean. And this helps us to quickly understand how unusual a score is. Honestly, Z-scores are kind of like base language of standard scores, and many other score types are built from them. T-scores are often easier for clinicians because they remove the negatives and the decimals. So a T-score has a mean of 50, a standard deviation of 10. Many personality and clinical assessments use T-scores, including the MMPI. And a T-score of 65 often signals clinically elevated symptoms on many instruments. And this is important because a high score is not automatically bad. On some scales, high scores reflect strengths. On others, they reflect symptom severity. Again, interpretation depends on context. Now, modern IQ testing uses what we call the deviation IQ scores. Most IQ measures, the mean is 100 and standard deviation is 15. So notice how that's different. We're always going to want to check and see what assessment the mean score and standard deviations are because they might not be the same across the board. So historically, IQ was conceptualized differently using mental age, but that model created major problems and is no longer the primary framework. Now, IQ scores represent relative standing compared to a norm group. This is also where counselors need to stay thoughtful and ethical. IQ scores have been historically misused culturally, politically, educationally, and diagnostically. And IQ does not measure worth, creativity, wisdom, empathy, resilience, or relational ability, to name some. And if it did, half of the cast of The Office would be unemployable. Michael Scott would have failed every structured assessment imaginable and still somehow maintain a management position for years. Human functioning is broader than test performance. Grade equivalence and age equivalence are often misunderstood. So if a child receives a 7th grade reading equivalent, that does not mean that they function globally like a 7th grader. It only means that their score was similar to the average performance of students at the grade level on that specific skill. And this becomes especially important in school counseling and psychoeducational assessment. Overinterpreting these scores can lead to inaccurate assumptions about ability or maturity. An assessment interpretation is always connected to ethics. The ACA Code of Ethics reminds counselors to consider validity, reliability, norm groups, accommodations, multicultural factors, and testing conditions. So, for example, if somebody takes an assessment while sleep deprived, or in severe distress, or in their second or third language, or in a distracting environment, or without accommodations that they need, the score may not accurately reflect their actual functioning. This is one reason ethical counselors avoid overconfidence. Assessment interpretation should include humility. So here's some common mistakes that you should watch out for. Confusing percentiles with percentages, assuming one score defines a client, ignoring cultural context, using outdated norms, over-pathologizing, interpreting beyond training, assuming assessments are unbiased, because they're not, they always have a bias, and relying on screening tools as diagnoses. And honestly, one of the biggest mistakes is forgetting that assessments are tools, not truths. A hammer is useful, but if every problem starts looking like a nail, something has gone wrong. So as we wrap up, here is the big takeaway. Assessment scores help us organize information. They do not define people. The counselor's role is not just to report numbers, it's to interpret them carefully, ethically, and contextually. So remember, Criterion reference tests measure mastery. Norm reference tests measure comparison. Percentiles are rankings. Standard scores create shared interpretation systems, and context always matters. And maybe most importantly, a person is always bigger than their score.